And welcome to the Critical Link Health Project. My name's Eric Stratman. I'm your host. But as I say, more importantly, to my left, we have the one and only Dr. Stephen Nedd, Chiropractic Physician. Is that right?
That's correct.
Excellent, excellent. All right, Doc. So we have known each other for a number of years, and we were talking on this before. When did it become Nedd Health Center? Was that like 2003, 2004? When did it actually become here in Clearwater? I think you made the move up from Fort Myers, correct?
That's right. I moved up at the end of 2007.
Okay, it's 2007, all right.
And took over for Dr. Harris, who you actually knew.
Yes, yes.
And then after a while, we decided to change it to Nedd Chiropractic and Wellness Center to be a little more encompassing.
All right, excellent, excellent. Now, you offer, obviously, chiropractic care, but what really astounds me is some of the latest and greatest that you're on. And what are you seeing that people are mostly coming in for, what they can mostly benefit from your actual care?
Well, I mean, it's a combination of things. It just depends on what their condition is. So we try to individualize. I don't have a cookbook approach.
Okay.
And also, I've never been a one-trick pony doc. You know, I have lots of tools in the, toolbox, so to speak. So if somebody comes in, let's say they're an athlete and they want to improve their performance, and I've had some that we're actually trying out for professional teams.
Nice.
Then we put them through a whole range of different assessments, check their squat, check their range of motion, check their strength, compare one side to the other, and then figure out what we need to do to get them performing optimally, whether it's an adjustment, dry needling acupuncture, cold laser therapy, nutrition, whatever it takes.
Now, what's the difference between cold laser therapy and hot laser therapy?
Well, it's kind of funny. It's actually not cold laser. They call it that because it's not hot laser, which is medical laser.
Okay,
but
cutting stuff.
Yeah, exactly. And cold laser is just low-level laser therapy. It's 5 milliwatts. You don't feel anything. You just see a red light. And it's a healing laser, so it therapeutically helps a number of things in the body. Reduction of pain, reduction of inflammation, helps the cells communicate better, helps the nerves work better. So it has many great benefits.
That is excellent. Now we're going to cut to an image here. So we're looking at a couple images here that we have you as the dog lover, big smile on your face, adjusting. That's what you're doing here, correct? Is adjusting a dog? Mm-hmm. Is that right?
Yes.
So how does that work when somebody even thinks, I would not have thought of it before meeting you that my dog needs an adjustment?
Dogs have spines too.
Dude.
So it's legit. I mean, they oftentimes can pull up lame.
Okay.
Down in the rears, and the vets can only do so much with cortisone and other standard veterinary procedures. And so we actually get referrals from local vets. And I've had dogs that some of them were going to be put down. They were so bad.
Right.
So by adjusting them, we're able to open up nerve channels, get the flow going back to their muscles, their rear limbs as well as their front limbs, and they start walking again, and it's amazing. In fact, I have a dog now, my own dog. He's almost 15, and he's got 2 degenerative hips and a bad disc, but I adjust him, I laser him, and he's just running around like a puppy. Yep. All
right. Now, how would somebody decide, like, hey, I think I need to get my dog checked, just not acting normal or walking funny? I mean, obviously for us, we're like, oh, my neck, my back, my hips, let me see the chiropractor. But how does that work for?
Well, usually it's pretty obvious that they have a hard time getting up in the morning. They're limping. If they try to turn their head, you can tell that they're in pain.
Okay.
And so in order to do that in the state of Florida, we have a legal form that has to be filled out first. Since I'm not a veterinarian, a vet actually has to assess the animal first and make sure it's safe. And we have special documents on our website that gets filled out in order for us to legally see the animal.
Now, you need to have that filled out to legally see the animal, but you don't need to have a medical doctor legally fill something out to see a human.
Correct. Yeah.
All right.
That's right.
All right. I mean, I don't get it, but, however it works. But, going back to that image, so now we're looking at, I'm going to point to the upper right where we're looking at some spinal decompression, correct?
Right.
So this is, quite almost like a wench system there, right? pulling the 4x4 out of the mud. What's going on there? So how does a spinal decompression work?
Well, we can use it not only for the lower back, but also the neck. We have a special attachment. We just turn the patient around and we put this attachment on, and it will actually stretch the neck too. And I mainly do this on patients that have disc problems.
Okay.
You know, either degenerative, bulging, herniated, ruptured. And what it does is it helps to decompress the disc by stretching, and then we keep the patient in a, you know, it's computerized, so we program it so that they're, for a short period of time, let's say a minute, they have the full stretch at, say, 100 pounds, and then it goes back down to about 80 pounds for maybe 15, 20 seconds, and then it goes back up again. So it creates a pumping action, so that allows the disc to rehydrate itself. Discs don't get a blood supply, so they have to absorb nutrition and water from their surrounding environment like a sponge.
Okay.
So the way this works is it creates like a pumping action, so it allows that to occur, and it also allows the pressure to go off the disc. When you're sitting in this position, for example, all your weight's crushing down on your discs.
Feels great.
Yeah, not if you're sitting for 8 to 10 hours a day.
No, not at all.
So anyway, when you're laying on your back, either on your back, or you can actually do this face down.
Okay.
It creates that stretching action and allows the discs to reset.
So you're saying it applies the force, pulling, and then relaxes and just keeps doing that? Okay, excellent. Now, how do you pin one down? Do you have some like seat belts, or what do you have that shows? I mean, I know we're looking at them, and it looks like this young lady has some type of strap around her waist, right? And then it's going to the machine at the other end. Is she holding her shoulders on something, or is she holding herself in place, or how does that work? Or
Yeah,
it's
well,
not enough to pull her down the table?
Yeah, well, first of all, we strap them in with 2 different harnesses,
Okay.
one around the waist and one around the chest, and then we put a seatbelt type piece around the waist area
Okay.
that the cable attaches to that's pulling them. And then underneath their armpits, there's blocks so that they don't slide down.
Excellent.
And it's really comfortable. It's done very gently and very slowly.
So you're saying those settings are from like really light to rip them in half? Or
Not
no?
quite. It's not like the rack, but
kidding.
it's you know, it's done slowly, and it's based on a person's weight. So we can go up to a maximum of half a person's body weight.
Oh, excellent, excellent. Now, looking at the bottom right, I know it's a little tough to see. We got some fading there, but the red lights on her arm, and you know, this has been a saving grace for me when I come to see you. That this is something that, from what I understood, stimulates nerve flow, blood flow. You have muscles that are shut down. A lot of people don't even realize that they should get muscle testing done. And that was, you know, always when I talk about, hey, you got to go see Dr. Nedd. It's, you know, one thing to have an adjustment. There's another thing to actually have your muscles tested, make sure they're functioning. We have 206 bones that can adjust and be out of whack, but over 600 muscles that need to be firing, right? So how does that differ from just chiropractic care?
Well, let's say, you know, I have somebody come in, they get an adjustment. So it's sort of like having a kink in a hose. You know, you're trying to get the flow of the water to go through. And when a vertebra is out of place, it can interrupt nerve flow that way. Well, the laser, the analogy I like to use with that is it's like this helps to increase the flow by turning up the flow.
Right.
And so we add that into it. It works at the cellular level. So it helps the cells communicate better. It helps stimulate what's called the mitochondria, which is where the fuel of the cell called the ATP is produced. So it produces more fuel, so the cells work more efficiently. And it reduces inflammation and pain and accelerates healing and reduces scar tissue. So there's tremendous benefits, and there's studies out showing this.
Yeah, and it's funny that I've seen patients that were clients of mine, athletes, and come in and get it done, and it's like they're like, there's some voodoo happening here, because this guy, you know, puts this applies this laser, and now all of a sudden my hamstring wasn't working and now it's firing. Was he really not pushing? Where's it at? How does it allow for that switch to just be turned on that quick?
It's all about functional improvement. I mean, that's what we want to see. If we test or assess a specific muscle, let's say your hip flexor, your psoas, you just can't hold your leg up. Well, we can laser the nerve or the nerves that go to it, as well as the muscles. And within 30 seconds, you'll see a palpable change. I mean, I can I can feel the difference because I'm not able to overpower them anymore, and the patient can lay there and they're like, oh my God, my leg is strong again. And then we'll see this person get up and they'll do squats again, like double the weight that they were doing. I mean, I've had patients where, big guys, where they were benching 250 and then all of a sudden they're at half of that. And we'll do one treatment with this plus an adjustment, open up those nerve lines, the power. You know, your nerves are your power and communication lines to the body. So if it's like having a blown fuse.
Okay.
And so you flip that fuse back on, and all of a sudden the power comes back. You see immediate miraculous changes.
And I love how you refer to the fuse, because I've always talked about, you know, the brain having that circuit breaker set up where you overuse a muscle and then your brain shuts it down. So pain is typically originating at the muscles that are being overused to compensate for the ones that are off. So I like how that you said that it's the, you know, looking at like you have a blown fuse, because I say, you know, this is what he does. He goes in and flips that switch on. You can't just go, oh, well, it'll be better, because that, you know, that's the mentality. Oh, I'll be fine. You know, it'll feel better in a week, or instead of going, it's like, man, see the light. It's the red blinky light, but see the light that is going to bring these muscles back on. Or do you typically suggest laser treatment for most of your patients that are getting chiropractic care?
It just depends. Usually when we start people, depending on the situation, I mean, if they come in really acute and they've got a lot of inflammation, in addition to ice and taking things like turmeric or curcumin or fish oil, then yeah, we can apply the laser immediately to start the inflammation reduction.
Okay.
But it's just case to case. Like I said, I don't have a cookbook approach. I treat everybody as an individual. And, you know, some people just come in, they get dry needling, they get acupuncture. Some people come in and they just get chiropractic adjustments. I have patients now, they just come in and do spinal decompression. So it just depends on each case.
Well, it's great that you have so many other offerings. Now, I know we went over a bunch, but what else are you offering that has been really helping your patients? Because the training that you have, I know you're a little modest guy. This is somebody that has gone to the Olympic Training Center. Knowing you for so many years and seeing you're always doing something new, studying something new, getting some new certification. What is it that you hold now that separates you from the other doctors in your area?
What we like to do is empower our patients, you know, instead of depending on me. And I like to use the analogy, you're not going to come in one visit and I'm going to touch you and your leprosy is gone. You're not going to get a Jesus treatment. I'm sorry. Right. There was only he could do that. So it's sort of like a team, you know. You come in and I identify where there are imbalances and weaknesses and so forth, but then I give you things that you can do at home so that it supports what we're doing and also enhances, and then makes you more responsible for your health, whether it's exercise or diet or other choices. And so
come on, exercise and diet have nothing to do with being healthy. Are you kidding me?
Yeah, you should know.
I know, right? It's like beating the dead horse. Like, hey, man, dude, I eat like crap and I don't work out, but man, my energy's low and I can't sleep well. I don't even understand what's going on.
Exactly. So, you know, we get into nutrition. We check for supplements. We even have a program now that we do blood testing, hair analysis. We have a body composition analyzer in the office now. And so we do a really thorough analysis. And then when we get all the results back, then we put them on the right supplements, the right diet, right exercise, and so forth. And also, in addition to that, we educate our patients by getting them to listen to our podcasts.
As you say, let's see where it's at. Boom.
So, started doing
chat. Check it out. So, when do your new episodes come out?
Yeah, we started doing this not quite 2 years ago. There's actually 85 episodes. They're out every week on Wednesday. There's a new one out each week, and just every topic you can think of having to do with health and natural health.
What are some of your favorite subjects that you've hit on that have been the most impactful and you've gotten the most feedback?
Well, you know, we've done a whole series on vitamins and minerals, so you're getting a whole education on that. We did a whole series also on hormones, and most recently we actually did a whole series on psychiatric drugs and related topics.
Because those are good for you.
Well, just listen to that and find out for yourself.
Yes, right. He's dangling the carrot there for you. I mean, you know, we always talk about how tough it is to be, you know, in the United States, be Americans, you know, where only 20% of the population have access to everything, but we consume 90% of the pharmaceuticals on the planet.
That's about
it's
right.
It's pretty tough to go, okay, well, hey, if there's a pill, there's an ill, and we're trying to get away from that. So it's great that, you're on the forefront. And as we talk about that, Critical Link Health's mission is to improve the health and wellness of our society. And, you're right there, and it's good to know you. Good to see the services you're putting in, and you're constantly adding things. What do you have now that is up and coming that people may have not been see that they've had exposure to away from the treatments we've already featured?
Well, like I said, the newest thing is our comprehensive nutritional analysis, where we combine everything together. And so
you said that's blood and hair?
Blood,
is it urine
hair,
as well, or no?
And it does include urinalysis,
okay,
and body composition analysis. And we even use a lab where we check essential fats in the body,
okay,
and see if you have too many of the bad fats, trans fats, and so forth. And so these are all really important. And a lot of people, they'll go and they'll get their standard annual blood test, and it comes back, everything's normal, and the doctor says they're perfectly healthy, but these people don't feel healthy. So we got to dig a little deeper, and so that's what we do.
Yeah, we have that conversation with, I had a guy that's got like a 55, almost 60-inch waist, and he's like, yeah, doctor says I'm healthy. I'm like, you can't see your feet. Something's wrong.
Right.
You're not healthy. I mean, you're not going to keel over and die from a heart attack today, but it doesn't mean that you're level with everybody else that has a 60-inch waist, or you're
Correct.
You're ahead of the game. But now, how do people find you? What's your website?
Our website is neddchiro.com. And
it's not Neddison.com. You got to check that out. You got to look that up.
We might have to change it to that someday.
Well, at least that's got to be one of the URLs that we can find you at.
Exactly. And then our podcast is at bodychatpodcast.com, as well as we have our own app. So if you search on any app, like, for example, if you have an iPhone, it comes with this little purple app. You just search for Body Chat Podcasts on there. Or we're on Stitcher, Spotify, iTunes, iHeartRadio, and so forth.
Okay, excellent. And then where are you located? What's your actual physical address in Clearwater?
We are at 1221 Cleveland Street, right next door to Nature's Food Patch Health Food Store.
Nice.
And it's at the intersection of Missouri and Cleveland.
Excellent. So serving the downtown Clearwater for over a decade, right?
That's correct.
So now we're going on almost 13 years there. But yeah, man, it has been awesome having you in. I want to get a big high five for you.
Yeah, man.
And if you guys want to check him out, see neddchiro.com. He's on all the social media channels. For your host, Eric, with Critical Link Health, the chiropractic physician, Dr. Stephen Nedd, you guys stay healthy.